Hi, Rod Rohrich. Welcome back to Rohrich Knows Podcast. Let's talk about migraine surgery. And migraines. How is migraines related to surgery? Well, I am honored to have with me the plastic surgeon, yes, the plastic surgeon that brought these two entities together, plastic surgery and migraines. You say, well, how does that ever work? Well, Dr. Guyuron has been a friend of mine for a long time, and he's an incredible innovator, an incredible plastic surgeon. And he really, really is to be credited for bringing this to the forefront, but also to helping relieve the pain of so many migraine sufferers around the world. So, Dr. Guyuron, welcome. How are you?
I'm fine, Rod. How are you?
I'm great. I'm great. Dr. Guyuron has been president of so many of our organizations. He's Professor Emeritus of Case Western and Plastic Surgery, past plastic surgery editor. He's done everything. So, Bahman, tell us about how, and he's a superb plastic surgeon, so how did you ever come to link migraines with migraine surgery? And then tell us about how you got to doing this procedure that's going to help millions around the world.
Rod, you and I know that one of the most important attributes of any physician is the ability to listen to the patients. And it started with a very sophisticated lady who happened to be a very famous surgeon's wife on whom I had done forehead rejuvenation. She came for a follow-up 6 months after the surgery, and she said, not only I like the way I look, I haven't had a migraine headache since operating. I thought that was coincidence.
How long ago was that? How long ago was that?
It was the 1999.
Wow.
1999. So obviously I didn't forget this. 2 weeks later, another patient repeated the same story. It didn't sound like coincidence anymore. So, as you know, you and I have research individuals around us all the time. So we went back and looked up. We had done forehead rejuvenation on 314 patients over the previous 10 years, and 39 of them had migraine headaches, and 31 had benefited from the surgery migraine-wise.
Wow.
So this was a study, but we did a lot of studies, as you know.
Yes.
We started a variety of studies, including neurologists, and looking into how this works and what is that we are doing, what is that we can do better. And we have published over 44 articles in this topic. And as you know, there are over 100 additional articles. And by now, 3 books, one of mine and 2 other books, have been published about the topic now.
Yeah, and really, all that I've learned from you, it's amazing. And you know, I love what you said, Bahman. It's the power of observation and listening to the patient. I mean, I think both of those are actually a forgotten art in medicine today. Because today, if somebody comes and sees you, you'll get a CT scan. And then we'll talk to you. I mean, it's so crazy. So it's that power, Bahman, that is I applaud you for that. So tell us how, for our viewers, this is a big global problem. Isn't it like 15 or 18% of the world population? Tell us how big this problem is. And medications aren't always the answer.
Yes. 1 out of every 4 households.
Wow.
At least 1 person with migraine headaches, 18% of the ladies, meaning 1 out of 5 ladies has migraine headaches. It is so common, and it is very debilitating. And many medications, yes, reduce the headaches, but there's no medication that takes away migraines, but without further need for medications. Surgery is the solution that offers, as you know, we have done many studies to show that long-term relief of the migraine headaches.
So tell us about What is the cause of it, and then tell us specifically about the surgery. So, what is the cause that actually, and you can relieve it by surgery. Have you shown is the cause of migraines in these patients?
Yeah, absolutely. Rod, in year 2000, I came up with this hypothesis, a proposal that migraine headaches about irritation of the end branches of the nerves that provide sensation to the face. And then there are cascade of events that occur after that and becomes irritation of the brain and membranes around the brain. And at the time, the neurologists were adamantly against that. They thought this is absurd because at the time, the hypothesis was that migraine headaches start from the brain, go to the periphery. You know who actually really became animated when I told them that this is my hypothesis? They were the physician patients of mine who had migraine headaches, or any other patient. They said, yeah, I feel that it starts from the branches of the some other areas on the face or head, then travels to the brain. But we have done also studies to show the reason. The genetic, going to go back to your original question, it is the condition is genetic most of the time, not every time that's the case. And we have demonstrated actually scientifically in the lab that nerves of the patients of migraine headaches are missing an insulation that is called myelin. And through a randomized study, actually, we showed that. And what it means that elements like pulsation of the vessel, contraction of the muscle, even minimal pressure that ordinarily doesn't irritate the nerves on patients of migraine, those elements begin those events that ultimately cause all that pain for the patients.
Yeah. So of course you had to show them with science. I mean, the neurologists were pretty much up in arms against you for a long time, and I guess some still are. But I mean, you have shown conclusively that A, that's really how it works, and B, when you do the surgery, it truly works. And so, tell us who are good candidates for migraine surgery. You know, when you see a patient today.
Yeah, Rod, anybody who has more than 2 migraine headaches a month, that it is debilitating, it is not really responding to the medication, lasting several days each time, and the medications or those who are not tolerating medications, or individuals with chronic migraine headaches, meaning more than 15 migraine headaches a month.
Wow.
These patients are candidate for the surgery. And we will talk about this in a short while, but the surgery has become so simple, and the recovery is so fast that my family members had migraine headaches, and I operated on them, and they have done great, because that's whatever is good for my family is good for my patients, vice versa.
Right. So tell us about that. So now with that criteria, so how do you evaluate a patient that, you know, they've met their criteria, they've had more than 2 migraines, they're debilitating, and you're right, medications, I see these patients, it's debilitating sometimes. If they've had a migraine, they're kind of wiped out for 3-4 days. I mean, that's not a good thing, and patients don't like that. So when you see these patients, I mean, how do you evaluate them, and because this is for our viewers, and then tell us about how this surgery is undertaken. Yes.
Yes, actually, many of these medications have so many side effects that they really reduce the brain function, memory, patients. But what happens, Rod, when a patient calls my office to get an appointment, the patient is instructed to keep a log of migraine headaches that they experience on a daily basis, or how often, and along with many symptoms. When they come to see me, I have actually a map of what is going on, but then I ask them to point to the area where the most common headache sites are, and then we make sure that those sites are independent trigger sites. Then I listen to the area with the device. That is one of my really discoveries that has helped us a lot in confirming that we listen to the area with a Doppler. Almost invariably, when the patient points to the site where the headaches start from, I'm going to hear that heart sound. They're not actually, in some areas, we have to have a CAT scan to demonstrate, meaning those who have headaches behind the eyes. We take CAT scan to show the pathology, what is actually happening. And that not only I can see it, actually I can show the patients exactly what I'm seeing. And they don't have to have any medical background to be able to see exactly what may be causing the headaches inside their noses. And we put all of these together, these, again, constellation of symptoms and the criteria information from the Doppler and the CAT scan, precisely go after the sites where the headaches are starting from. So
good. So tell us about the surgery. So what are the most common sites for origin of the migraines and that are treatable with them?
Yeah, temples, forehead, back of the head, behind the eyes. Those are the sites. But some patients have headaches starting from the vertex, the top of the head. But majority are the sites that we talked about.
So take us into the operating room. So they're now proven to be candidates, and then you say it's outpatient surgery. Tell us about the typical type of patient that has this.
Yeah, Rod, we have discovered, I have found 7 trigger sites for migraine headaches and developed an operation for each. And it depends on where the headaches are. Some, and actually a good number of the patients, all they need is just a tiny incision under local anesthesia, removing the vessel that is irritating the nerve. They walk out, they can go back home, even if they can even travel, they will go back to work the next day. A good number of patients, this is what they need. But there are patients who have complex situation. I may have to operate on 2 or 3 or 4 sites. In fact, today I operated on a lady who has 6 different trigger sites.
Wow.
That is uncommon. Most patients have 2 or 3 trigger sites, and all of these can be done as an outpatient operation under local anesthesia or general anesthesia. They can usually go back to work the next day or a few days after the surgery. Some may have some swelling, bruising around the eyes for a week or so, but essentially they go back to normal life in a very short period of time.
Yeah, I mean, that's truly revolutionary. So why wouldn't we just skip and go right to surgery, Mom? And I think if I had migraines, I'd come see you. I mean, because first of all, as physicians, none of us we don't like drugs. We don't like taking drugs. I mean, we give it to our patients if they need it for after surgery. But so tell us as our take home, what is the ideal patient that you could help that really would benefit from migraine surgery from you or one of those people that you've trained around the world?
Well, ideally, I want the patient to see a neurologist because I'm not a neurologist, and to make sure that the migraine headache, the diagnosis is proper. They indeed have migraine headaches. And again, those patients who have difficulty taking medications, or they really, even with fewer 2 or 3 migraine headaches a month that last several hours or so, and then they really have to stop working for that particular day or several days. Those are the patients that I know that I can help them. And I'm not the only one, as you know. I've trained hundreds of surgeons across the country that can do that, and the patients don't have to come to Cleveland. And we do have actually a migraine society. They can go to the website and find out who is the person in their area who's doing this type of surgery. Their names are there listed. And I'm willing actually to guide the patients. They want me to tell them who's in their area. If I know for a fact, I can refer the patients to their local surgeons to take care of them. So those, I think it really is an enormously gratifying operation to patient after patient telling me that I have changed their lives. And I really get a lot of thrill out of those statements day after day.
Yeah. Truly amazing. Dr. Bahman Guyuron from Cleveland. Unbelievable. He has truly revolutionized this part of medicine. And I'm proud to say, not only is he an amazing plastic surgeon, he's a great friend of mine. Unbelievable. I'm so glad that you could join us today. And I know we're going to have a lot of comments from our viewers. And thank you again so much, Bahman, for joining me. You've helped so many thousands and potentially millions of people, and you've trained a lot of people. So a true example of an amazing plastic surgeon that gives back. Thank you again, Dr. Guyuron.
Thank you, Rod. It was great seeing you on the video.
Great.